Hi, this is Dr. John Heary, and today we are going to talk about the amazing benefits of olive oil. Um, so, olive oil is as we all know, it's it's touted as being very healthy. Some consider it a superfood source. Olive oil, it's healthy. It's rich in the healthy monounsaturated fats, and the key fatty acid in olive oil is called oleic acid. Now, this fatty acid's been found to be responsible for lowering inflammation. There's also research that shows or that suggests that oleic acid it can reduce the levels of important inflammatory markers that you get done in your blood work, like high sensitive C-reactive protein and also interleukin 6. Olive oil has also been shown in research and some of the studies that people who consume it, it does reduce stroke events. There were a bunch of studies done, and there's 32 cohort studies in which they had over 800,000 people, and what they found was that olive oil was the only source of monounsaturated fats that was associated with a reduced risk of stroke. And now there's also, cardiovascular benefits as well. Olive oil intake, it's been shown to lower blood pressure. In one of the studies, it showed that olive oil reduced the need for blood pressure medication by 48%. Now, this study, they found that a single dose of high polyphenol olive oil increased endothelial function. Now, the endothelial cells, those are the cells that are in the the interior lining of the blood vessels. It also decreased the bad cholesterol, the LDL cholesterol, from oxidation, and it also helped to moderate glucose levels as well. Several of the studies they found that olive oil, when you combine it, with a Mediterranean diet, that can also help reduce the risk of type 2 diabetes and improve insulin sensitivity. They also did some study and research on how olive oil affected Helicobacter pylori. And in a study, it showed that 30 grams of extra virgin olive oil taken on a daily basis can eliminate Helicobacter pylori infection in 10 to 40% of people in less than in little as 2 weeks. And the results of the lab study showed that olive oil's phenolic compounds, they were effective against 8 strains of H. pylori, including 3 that are resistant to some antibiotics. Now, H. pylori infections, it's known to cause ulcers. It's known to cause inflammation in the stomach, the small intestine. Now, one thing that you do want to be careful of is that there's a lot of companies out there that put olive oil on the shelves in which it's diluted. It's really more of a fake olive oil. It's not as healthy as you would think it is. Um, one of one of the stamps of approval is given by a company out of California, and they check olive oils to make sure that it is pure. So you look for the approval. It's called the California Olive Oil Council. It's COOC certified extra virgin. However, though, if your olive oil doesn't have that stamp of approval, and if you're ever in doubt, you can test for fake olive oils yourself. All you want to do is just simply take your olive oil, refrigerate the oil. It should become more solid as it gets colder. If your oil doesn't become thick and cloudy in the refrigerator, it's probably fake or a lower grade olive oil, or it's diluted, mixed in with other types of oils. So again, either do the refrigerator test on the olive oil you do have, or see if you can find olive oil that has the California Olive Oil Council label on your bottle. There are some other sources of olive oil, or other people who are known who put their stamp of approval on the olive oil and that do check the purity as well. But my advice is that definitely stick with high quality brands that pass the University of California test, or like I said, take your olive oil, put it in the refrigerator, do the refrigerator test, and just make sure that the olive oil you're consuming is actually, 100% that, it is olive oil and that it's not something else. Well, again, it was great talking to you guys today. You guys have a great day, and I will look forward to talking to you guys soon. All right, take care now. Bye.